Esophageal cancer is a malignancy that arises in the esophagus, the tube that carries food from the throat to the stomach. Though it may not be the most talked about type of cancer, its impact is profound, affecting thousands each year and presenting challenges in early detection and treatment. The early warning signs of this disease often mirror symptoms of more common, less serious conditions, making it easy to overlook them until the cancer has progressed. That is why recognizing the early warning signs can be a game changer, potentially saving lives by prompting timely medical intervention, which is what we're going to uncover in this video. So keep watching if you want to learn about the signs that you must not overlook. Number 1. Difficulty swallowing. Difficulty swallowing, medically known as dysphagia, is often one of the early warning signs of esophageal cancer. This symptom arises because the tumor starts to obstruct the esophagus, making it hard for food to pass through. Initially, it might only occur with solid foods, but as the tumor grows, even swallowing liquids can become challenging. Individuals may feel like food is stuck in their chest or throat, leading to coughing or choking when trying to swallow. This symptom can significantly impact nutrition and hydration, emphasizing the importance of medical evaluation if it persists. Number 2. Unexplained weight loss. Unexplained weight loss is a concerning symptom that can be associated with various types of cancer, including esophageal cancer. It occurs without significant changes in diet or exercise habits and is typically unintentional. In the context of esophageal cancer, weight loss might result from the body's increased energy expenditure to fight the cancer, as well as difficulties in swallowing food, leading to decreased calorie intake. Losing a significant amount of weight without trying can be a signal that the body is not absorbing nutrients effectively, warranting a thorough medical examination to determine the underlying cause. Number 3. Chest pain or pressure. Chest pain, or a sensation of pressure in the chest area, is a common symptom that can be associated with esophageal cancer. This discomfort can range from a mild persistent ache to severe pain, often mistaken for heartburn or cardiac issues. The pain may not be directly related to eating and can intensify when lying down or bending over. It's believed that the tumor's growth within the esophagus or its spread to surrounding tissues and nerves contributes to this sensation of pain or pressure. This symptom is particularly concerning when it occurs without an obvious cause and persists, necessitating medical attention to rule out esophageal cancer among other potential diagnoses. Number 4. Chronic cough. A chronic cough, especially one that doesn't seem to go away with typical treatments or is not associated with other symptoms of a respiratory condition like a cold, can be an early warning sign of esophageal cancer. This cough might be dry or could produce phlegm, and it's often more persistent than the coughs associated with viral infections. The cough can be caused by the tumor irritating the esophagus or by the cancer-causing fluid to build up in the lungs, leading to a cough to clear the airways. While a chronic cough can have many benign causes, when combined with other symptoms like difficulty swallowing or unexplained weight loss, it warrants a thorough medical evaluation. Number 5. Indigestion. Indigestion can be an early warning sign of esophageal cancer, although it is a common condition with many other causes. It encompasses a group of digestive symptoms that occur together, including pain or discomfort in the upper abdomen, a feeling of fullness during or after a meal, and a burning sensation behind the breastbone. In the context of esophageal cancer, indigestion might result from the tumor affecting the normal function of the esophagus, leading to difficulty in food passing smoothly into the stomach. This system can be easily overlooked because it is frequently attributed to less serious digestive issues. However, persistent or severe indigestion, especially if accompanied by other symptoms like difficulty swallowing or weight loss, should prompt a visit to the doctor for further evaluation. Number 6. Regurgitation. Regurgitation in the context of esophageal cancer refers to the sensation of food flowing back up into the throat or mouth, without nausea or the forceful expulsion associated with vomiting. This symptom occurs when a tumor in the esophagus impedes the normal passage of food into the stomach, causing the ingested food to return to the esophagus and sometimes the mouth. Regurgitation can lead to a sour or bitter taste in the mouth and can contribute to additional symptoms such as bad breath. Unlike common reflux, which can have similar symptoms, regurgitation related to esophageal cancer is often not resolved with standard treatments for gastroesophageal reflux disease and persists over time, indicating the need for medical assessment to determine the underlying cause. Number 7. Fatigue. Fatigue associated with esophageal cancer is a pervasive sense of tiredness or exhaustion that doesn't improve with rest. This type of fatigue can be more intense than the usual tiredness people experience. In the context of esophageal cancer, fatigue may result from the body's effort to fight the cancer, the stress of living with a chronic illness, or from the cancer interfering with the body's ability to absorb nutrients properly due to issues with eating or digestion. It's also possible that anemia, a common condition in cancer patients due to decreased appetite and intake, contributes to this fatigue. Fatigue linked with cancer is often profound and can significantly impact an individual's daily life and overall well-being, making it essential to address with healthcare providers. Number 8. Blood in stool or vomiting. The presence of blood in the stool or vomiting is a serious symptom that can indicate esophageal cancer, among other conditions. Blood in the stool may appear as bright red blood or as a dark, tar-like substance indicating digested blood. Vomiting blood, medically known as hematemesis, may also occur if the cancer in the esophagus bleeds into the digestive tract. These symptoms can result from the tumor causing damage to the esophagus lining or from the effects of the tumor on nearby blood vessels. The bleeding may not always be visible. In some cases, it's detected through tests. Any occurrence of blood in the stool or vomiting warrants immediate medical attention, as it can indicate a serious underlying condition and can lead to significant blood loss and other complications. Number 9. Throat pain. Throat pain or discomfort is a less common but possible early warning sign of esophageal cancer. This symptom might manifest as a persistent sore throat that doesn't improve with traditional treatments or over time. The pain can also be described as a feeling of pressure or burning in the throat. It occurs when the cancer affects the upper part of the esophagus or when the tumor's presence in the esophagus triggers nerve responses that cause the sensation of pain in the throat area. This discomfort might worsen when swallowing, eating, or drinking. Since throat pain can be associated with many other conditions ranging from infections to other forms of cancer, it's essential to seek medical evaluation for persistent or unexplained throat pain, especially if it's accompanied by other symptoms like difficulty swallowing or unexplained weight loss. Number 10. Persistent throat clearing. Persistent throat clearing is a symptom that can be indirectly associated with esophageal cancer, although it's more commonly linked to conditions like allergies, acid reflux, or respiratory infections. In the context of esophageal cancer, constant throat clearing might result from the body's attempt to clear the throat due to a sensation caused by the tumor in the esophagus. This sensation can be similar to the feeling that something is stuck in the throat or neck area, prompting an involuntary response to clear it. This symptom alone is not typically indicative of esophageal cancer, but when occurring alongside other warning signs such as difficulty swallowing, indigestion, or weight loss, it may warrant further investigation to rule out this and other serious conditions. But as you can see, recognizing the early warning signs of esophageal cancer is essential for early detection and timely intervention. While some symptoms may be subtle or easily dismissed, it is important not to ignore any persistent or concerning changes in your health. If you experience any of the mentioned symptoms or have any other concerns, it is vital to consult a healthcare professional for proper evaluation and diagnosis. Early detection can significantly improve the chances of successful treatment and better prognosis for individuals with esophageal cancer. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching, have a blessed day, and as always, breathe easy, my friend.